Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
Hi, I'm Dr. Joe Lemaster, Local Health Officer for Johnson County. So today we want to address a little bit more about vaccination, our best hope to completely eliminate the risk of COVID-19 in our communities. As you know, the risk of getting the infection or being hospitalized or dying from COVID is much less among those people who have had full vaccination. As of this date, we have plenty of vaccine. Anyone who wants to have the vaccine who is 12 or over, it's available for you. We have regular clinics that are that you can come and get vaccinated. You can make an appointment. We have outreach events in the community. You can go on our website at jocogov.org and find one that will be available in your local area. Now, what about the thought that some people have that says the pandemic is over, I didn't get infected, there's enough people vaccinated now, I don't need to get vaccinated? Well, we can say one thing for sure, and that is those people who are still getting infected and land up in the hospital with COVID who have not been vaccinated are very much sicker than those who, by chance, if they do get infected and end up getting hospitalized, they are not nearly as sick. And I will tell you that the people who were vaccinated were not very sick. Even if they were hospitalized, they were just sick enough to be in the hospital. Whereas the people who were not vaccinated, just like we've seen all the way through the pandemic, those are the people getting very sick, prolonged hospitalizations, declining into more and more oxygen need, needing to go on a ventilator, and eventually some of those people dying. That's what we've seen the whole time through the pandemic. We're still seeing that. So it's very important to get vaccinated. It does reduce your risk of becoming infected about 80% so. However, we're not saying that it will eliminate that risk 100%. If you've got large crowds of people in an inside situation and no one's wearing a mask, the likelihood of somebody in that situation having COVID and spreading it to other people remains high. They can even potentially spread it to a vaccinated person who maybe wouldn't even get sick and then pass it to somebody else. That's the most likely type of an infection a vaccinated person would have, was an asymptomatic infection, and they may still be able to pass it on to someone else. Now let's talk about the variants a little bit. You've heard about the Delta variant. This is the one that was causing the big wave and new surge of many, many cases and deaths in India. It is in the United States. It's becoming the dominant form of COVID that we're seeing in our communities. This is a really bad actor. It is about 6 times more transmissible than the original UK variant, which was already more transmissible than the original virus, and it causes more sickness. The people who get it and get sick are more likely to die, especially the unvaccinated people. So this is nothing to mess around with.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.